Ever been curious about Conor McGregor's hairline? The legendary UFC fighter is renowned for his fierce battles in the ring and his unmistakable style. Join me as I delve into a hair transplant analysis of the notorious MMA. There's a lot to learn from his hair journey. In 2013, at the age of 25, Conor has a central hairline position that's appropriate for his face. He has mild frontotemporal recession, and you can see that in the corners of his hairline. He also has strong frontal, mid-scalp, and crown density at this point. And he does have a scar on the left posterior temple. In 2014, at the age of 26, I see some temporal thinning. So there's recession now, not just of the corners, but also of the temple area right here. But if you look closely at his hairline, there's an irregularity to it and a fineness that's quite natural. And those are some of the defining characteristics of a natural hairline. In 2015, at the age of 27, right at the frontotemporal corners, Conor is partially masking the recession with the temporoparietal hair that is coming in from the sides here, and he's combing it forward. But the central hairline is at a proportionate height relative to the midface and the lower face. You can see here that the midface is vertically his shortest segment of the face. In 2016, at the age of 28, now that he shaved his head, you can see the natural hairline pattern that's well visualized in this photo. There's both micro irregularity to the hairs, but there's also macro irregularity in that the hairline, as you follow it from left to right, has this undulating type of pattern. And we talk about this type of patterning in our video called How to Fix a Receding Hairline. And if you look at the directionality of his hair right at the hairline and in the frontal scalp, there's this standard type of fanning pattern. So essentially the direction of the hair is anterior or forward facing, and as you go from left to right, it basically fans around. And so when we do surgery, we try to recreate that if that's the patient's baseline pattern. But keep in mind that there are many other variations. Given Conor's age in these photos, I wanted to mention that the worst time for male pattern hair loss to accelerate is usually in our mid to late 20s into our early 30s. That's when hair loss is the most aggressive. And during those times especially, it's important to be on medical therapy for your hair to both preserve it and to give it the most full appearance that it can have around that time, and of course in later decades as well. To learn more about prescription hair medication and other things you can do to bolster your hair, head to feelconfident.com. In 2019, at the age of 31, what I'm seeing here is that the right side of his hairline is now more receded than the left side. And this is the case for about 90% of men. And it's unclear exactly why, but I see it in my practice all the time. Not only is the right corner more recessed, but in most people, the right side of the forehead is also your wider side and the side that tends to be more curved. And that ultimately impacts on how our hair looks. You can also see in this photo that there's slight thinning at the central hairline. And this is something that happens as we continue to age. And in 2021, at the age of 33, initially I saw no change when looking at these specific photos. That was of course at first glance. But as I looked through 2022, what I seemed to discover was that it looks like he may have had a hair transplant, most likely around October or November of 2021. In mid-January of 2022, we're seeing some early signs of hair growth at the transplanted hairline. This is now maybe about 2 to 3 months post-operative, and this is when we're first starting to see fresh growth of hair. Remember, initially after a hair transplant, the hair that's transplanted actually falls out, and then it takes a few months for you to start to see new growth. And that growth happens gradually over the course of about a year to a year and a half. And as I look at photos of the back of his head, I don't see any linear scars. So that suggests to me that this was probably an FUE type of procedure. We have a video that covers the differences between FUE surgery and FUT surgery. By April of 2022, you can now see a lower, straighter type of hairline. And you can also see that the temples appear more medialized. They've been brought back in. And by about September of 2022, his hair has reached essentially its full growth potential. And I estimate that the size of this procedure was about 1,400 to maybe 2,200 FUE grafts. And then I looked at his hair throughout 2023. He's now 35 years old. It doesn't appear that he's had any additional hair work done, but what I do see is that there's actually a weakening of the hairs that were originally transplanted. So this begs the question of how could this be? He's now 2 years out from his purported hair transplant, and we're seeing that the hair is actually looking thinner. Now, I think there's two main reasons why this may have occurred, and the first is because of the FUE technique. Follicular unit extraction is the most widely used harvesting technique in modern day hair transplant surgery. And while you get to skip the linear scar in the back of your head, one of the problems with it is that you need to harvest over a broad area on the back and sides of the head in order to disperse the harvest so one area doesn't look over harvested or overly thinned out. As you do that and you broaden your harvesting zone, you essentially are going into areas that are not completely safe as far as DHT sensitivity. So if you go into areas that are DHT sensitive, what happens is you're taking out hairs that are genetically programmed to eventually fall out anyway. And if you take some of those hairs and you move them to a new location, they're eventually going to fall out because that's what they do, unless you're on some protective medications. If you're not on any medical therapy like finasteride, you're eventually going to lose those hairs that were programmed to fall out from the get-go. And so I think that he may have had either a very broad FUE harvest where some of those hairs were DHT sensitive, and or he probably was not on the protective medications that then led to that hair that was transplanted falling out. One of the positive attributes of his hair transplant is that they used, it looks like, mostly single hair grafts right at the hairline. And as I look closer, it looks like it's not just at the first few rows where single hair grafts were used, but also further back for that entire inch and a half of transplanted hairline. Now, it's possible that they intended to do that, even though in a natural hairline, you only have single hair grafts, usually at the first few rows, and then it builds into heavier grafts. So what's another reason why this may have occurred? Another reason this happens is because the punch size that's used for FUE is sometimes too small. The intention is good. The surgeon wants to minimize the size of the scars. So to have smaller scars, you have to use then a smaller punch. But as your punch size gets too small, you end up partially transecting your grafts. So instead of catching those 3 and 4 hair grafts, you end up only capturing, say, a single or maybe a double out of that, and the rest get transected because your punch size is too small. In terms of aspects of his hair transplant that I think could use some improvement, we have the appearance of the hairline that looks a bit too straight across. In natural hairlines, especially as we reach our mid-30s and beyond, the hairline tends to have a slight bit of curvature as you get out to the sides. If you make it perfectly straight, it looks a bit artificial. Also, the hairline was brought down quite low. As I said earlier in the video, to me, his facial proportions were great to begin with. So now they've lowered that hairline, including centrally, down. So now it looks like the top third is a bit short. The transplanted area also lacks density, and we've spoken about why that might be with the possible partial transection or the overuse of single hair grafts. And of course, for the potential of progressive thinning that may have occurred as DHT sensitive hair was transplanted. Also, if you look at his temples, the hair direction and angulation appears a bit unnatural in that the hairs were not placed flat enough. In order to do that, when I operate, I make sure that the head is quite flat and then I'm right there over the patient creating the sides. And I like to use very fine blades with a fine blade handle that allows my hand to get quite flat to recreate that type of angle when it comes to temple work. It's very important, or else it's a dead giveaway that a hair transplant was done. And I always caution men who want to lower their central hairline, and we have an entire video about that. So again, very important, especially if you're going to go with a little bit of a lower hairline, to be on medical therapy. And again, to learn more about medical therapy like minoxidil, finasteride, head to feelconfident.com. And if the hairline is lowered, it's important to tell patients that oftentimes they'll need to come back for an additional procedure to increase the density. It's very common when you're working into bare areas, like lowering hairlines into bare scalp, that you're not going to create the density of the original hair. it's actually impossible to recreate original density with bare areas. So you're going to build up the density with a single surgery, and then you're going to come back in to bolster that density even more. And to find out more about the costs of hair transplant surgery, we did a video recently on $1,000 versus $50,000 hair transplants. Make sure to check out that video.